Irhs batch 2019. I have been asked by Dr. Sagar to share my interview experience of UPSC examination and also to give some important tips for the candidates who are going through the interview this year. So first of all, that this part of the interview which is known as the personality test. It's the interview that includes two components of a person. First, the personality perspective, second, the medical perspective. So it will be different for each and every person, varying whether you are an intern or you are post MBBS personnel or you have some specialization in that particular field. So let's come one by one that how we need to focus on our personality part. For personality part, the main thing is the mindset that yes, I am going for this UPSC job and I am prepared and I have full confidence that I am going to serve as class 1 gazetted officer for Government of India. That is important. So when you have that mindset, then only you can develop your personality, and to develop the personality you have to keep in few things in mind. First of all, that your dress up. So as you are going for an interview for a class 1 gazetted officer job, you have to look smart. For smart, you need to wear some decent formal dress whenever you appear in an interview. That will give you the first impression. So get ready. The boys take some blazers with tie and clean, nice and clean polished shoes. That is an important part of the personality of a person. Second, how you behave. Always have a good confidence when you go for the interview, as it is common to all the government jobs as well as for girls also. So the most of the part, what are the details and description, is already being covered by the Dr. Sagar. I will take the how once you enter in door and see the what is the interview panel that we have in front. So when you enter into the room, wish each and every interview panelist and stand by the side of the chair and do not sit until and unless asked. So when they give you whenever they ask you, please Dr. so and so, please have a seat, then only take a seat and respectively sit in front of them and with a good posture that you are confident enough for this interview. So basically what that panel consists of, there are usually 4 members. Out of 4 members, 3 members are from the medical field and 1 member is an IAS officer. The main purpose of the IAS officer is to test for your personality, that how you are behaving in that room, how you are tackling the situation, and accordingly he will give you the marks. For that he will look how you are dressing up, what is your confidence, what is your way of talking, what type of language that you are expressing your thoughts. That is the most important part. And rest 3 faculties, they are from the medical background. They can be either from the medicine, pediatrics, from obs gynae, orthopedics, surgery, and even sometimes from ENT, PSM department. So they will have different panelists for different group of people. So you should be prepared in mind that you are going to be bombarded with such type of the questions. So the personality part is already being assessed the moment you have entered into the room. Now, how he is going to pursue? Basically, during the filling of the DAF, the most important part that I have already discussed in some previous videos, that is what you are going to fill in the DAF. That forms the basis of your interview purpose. That DAF part, whether it includes your sports activities, your cultural activities, your hobbies, that everything that part you have covered in your DAF will be asked by that IAS officer, because he needs to assess your personality. For me, during my interview, I have been asked some questions related to the dance form that I filled. I have felt that I used to do cultural dance, so he has asked me what different type of dance forms you are doing, how you are doing, and even he has asked that if the interview goes well, at the end he wants me to perform dance in front of all the panelists in that interview room. So accordingly the interview went. So from first, my 3 medical faculties, first from the orthopedic department. So as an intern, during my internship time, they used to ask what I did in my internship period. So that part included, he said that what are fractures that you have reduced and how you have applied some cast and everything, what type of x-rays you will perform. So basically he will ask whatever you say. You are the person who will lead the interview. If I say that I have done the reduction of the Colles fracture, then he will take that interview to that part. If you say that I have done a particular traction, he will take the interview towards that part. Similarly, from the medicine, they have given me a situation that some person is brought to the emergency department, and how you will proceed. Then you will give the differentials, and accordingly differentials, they will ask what all investigations you will perform, how you will properly manage, follow up until the end of the treatment. So that's how you will take up the medicine part. Even it is everything until and unless they stop you or they abruptly they ask you some different questions, then that would be a great problem. But usually they are supportive people. They will, as a medical faculty, they will help you to build up your good reputation in front of all the other 3 faculty members. Similarly, during the last part of my interview, I had one medical faculty from Obs and Gynae department. She asked everything starting from my antenatal, how you will do the antenatal OPDs, how will you do the labor room, what are all complications that you can have, particular procedure like episiotomy, how you will perform that, and what are different anesthesia that you give. The common things that a person that do during internship are being asked. So at the end, all these faculties, 3 faculty, medical faculty, they are very supportive, and they help you to build up that whatever knowledge you are carrying with you and to express in the during the time of an interview. So it doesn't depend that what are the questions that are being asked, and these questions usually they are not repeated. It depends what you are going to say. If you are an intern, they will ask you what you have done during your internship. So it solely depends upon the part that what you are going to say there. If you are a specialist cadre or if you are a specialist person who is giving the interview, then that part will be related to his specialty most of the time. So basically, at the end, it depends upon the person who is giving the interview, how I'm going to take the interview to which direction. And at the end of the interview, if you are confident enough and some of the questions, then that IOS officer, he will help you to conclude the panel. And at the end, he asked me to perform, even he asked me to perform that cultural dance, and that I have done in the end. So the total duration of the interview can take from 15 minutes up to 30 minutes. It completely depends upon you, how you are going expressing yourself in that interview part. But at the end of the interview, if you know the result, if you know the question, say yes sir, and if you don't know the answer, just slightly humbly accept that you don't know and you say that sorry sir. So these are the important basic crux of the interview that you should present yourself in during the whole that 20 to 30 minutes of duration that is given to you. And after that, at the end of the interview, you get outside and give them say a warm welcome, say thank you to everyone, and leave the room with a full confidence.